How's it going, guys? We have a medium difficulty question for pathology for step one. Some of you guys will think this is too easy. Okay, fine. All right. But there's some of you watching this who have no idea what's going on. So before we get started, please subscribe to my channel. I really appreciate it. Give you a like, really appreciate it. Find me on Instagram, Mehlmanmedical, Mehlmanmedical, links down below. Find me on Telegram, links to the Telegram group channel down below. And I'll start the clip. 9-year-old boy. He has a skeletal analysis showing lytic lesions of the skull and ribs. Molecular analysis shows cells that are CD1A positive. A Qbank granule is shown. So the cell type that is hyperproliferative in this patient's condition is most likely to have which of the following salient functions. Now it's a pass level diagnosis for starters in that this is simply Langerhans cell histiocytosis, okay? So I gave you Buzzy for a reason, CD1A, positive cells, Qbank granules. This is on purpose because I'm not trying to obfuscate the diagnosis. Like, yes, we want you to know it's Langerhans cell, and this is what the USMLE is going to do. But then we ask you a medium difficulty question, a bigger picture concept. Well, do you know what Langerhans cells are? Do you know what they do? That's actually what USMLE cares about. They don't necessarily need to give you an obscure presentation and have you play a trivia guessing game of OMG, do you know what the diagnosis is? Okay, so here this image is a bit tricky because I'm showing you a rod-shaped Qbank granule. Okay, they don't have to be tennis racket shaped. Some of you watching this clip have heard of Qbank granules. You'll know that they're tennis racket shaped. But if you've actually gone through my pathology PDF that I just put out, and by all means, I'll link it down below in the pinned comments, I actually mentioned that Qbank granules can be rod shaped as well. Okay, so USMLE 50% of questions. It's not that there's that many of these questions floating around, but half of the Langerhans cell questions will give you the buzzy tennis racket shaped Qbank granule, and half will give you rod shaped like this, and you get lytic lesions. So let's just look at the answer choices here. I prefaced long enough. Choice A, antibody production, wrong fucking answer. So antibody production is going to be plasma cells, which are mature B cells. Okay, so B cells mature into plasma cells, secrete immunoglobulin, obviously crucial for humoral immunity. There could be some students watching this who've conflated the lytic lesions here with multiple myeloma, obviously completely different presentation, patient over the age of 50, back pain, hypercalcemia, etc. Long discussion, okay, made plenty of clips on that. But if this were multiple myeloma and we had plasma cells as our, obviously, the pathogenic cell type involved, then antibody production would be correct. In this case, wrong fucking answer. Choice B, osteogenesis, wrong fucking answer. So, okay, it's a distractor because we have lytic lesions, right? But it's not related. Osteogenesis, bone formation, osteoblasts. You could make an argument that osteogenesis, the process holistically, this could refer to the homeostasis between osteoblasts, osteoclasts. But if we were forced to choose a cell, we would say osteoblast. It's a cell that builds bone. Okay, so even though we have lytic lesions here, it's not related. You could just be aware that the Langerhans cell histiocytosis, it's going to be some obscure condition, oftentimes in peds, where you get CD1A positive cells, Qbank granules that are tennis racket or rod shaped. The patient can present with lytic lesions. Osteogenesis, wrong fucking answer. Choice C, presentation of antigen, MHC1 and CD8 plus T cells, wrong fucking answer. So some students are going to get pedantic and say, but wait, Michael, all cells in the body, including all nucleated cells, including Langerhans cells, do have the capacity to absolutely present antigen on MHC1 to CD8 plus T cells, i.e. viruses. Okay, so the virus invades a Langerhans cell, for instance. I mean, sure, yes, the Langerhans cell is capable, like any other nucleated cell in the body, of presenting antigen on MHC1 and CD8 plus T cells. Okay, fine. But I wrote salient here, the salient function. Okay, forest for the trees. What do Langerhans cells actually do? Choice D is correct. Okay, so Langerhans cell is what's referred to as a dendritic cell. A dendritic cell, when I describe this to students, when we talk about immunology, I refer to it as the designated hitter in baseball, meaning the designated hitter does not play defense. There's no position on the field. The designated hitter literally is just a hitter, does not have any other purpose. So a dendritic cell is a designated hitter for antigen presentation on MHC2 to CD4 plus T cells. That's the only thing it does. Okay, when we have B cells and macrophages, those are the other antigen-presenting cells, APCs, antigen-presenting cells, that refers to cells that present antigen on MHC2, phagocytosed antigen, to CD4 plus T cells, okay? But B cells also have another function of making antibodies, maturing into plasma cells, right? Macrophages have another function of phagocytosing and then digesting / destroying antigen. But dendritic cells are found throughout the body. In the skin, they are simply just called Langerhans cells. Okay, so Langerhans cells is a dendritic cell of the skin. It's a designated hitter. All it does, its only purpose is to phagocytose antigen and merely travel to the lymph nodes or spleen, to any lymphoid tissue, and present it to CD4 plus T cells. Okay, it's capable of obviously carrying out MHC1 CD8 plus interaction, but the salient function of APCs is MHC2 to CD4 plus interaction. Quickly, finalized choice for spiritual bears, wrong fucking answer. Most saliently refers to neutrophils. Okay, so you're gonna have the whole process of NADPH oxidase. So you're gonna be converting molecular oxygen to superoxide, superoxidase mutase into H2O2, hydrogen peroxide, which in and of itself can destroy phagocytosed antigen, H2O2 to hypochlorite to bleach via myeloperoxidase as well, can function to destroy antigens. We talk about catalase positive organisms. Okay, the whole route of dihydrorodamine test or tetrazolium blue assay. Okay, dihydrorodamine has replaced tetrazolium blue assay as correct answer. I believe it was offline MHC. What the fuck am I saying? Offline NBME 15 or 16, where dihydrorodamine test is correct over tetrazolium blue assay. Point is, wrong fucking answer. You know the deal. Makes you make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.